I found osteopathy the first time because of my daughter. When she was very, very young, she started getting ear infections. And I was blessed to be working with an internist who, and he said, "You will not give her surgery. You will not put plugs in her ears until you go see this amazing osteopath." So, like the good girl that I am from Kansas, I did that, and I took her, and a doctor literally worked on her one time, and she never had another ear infection. She had had a very traumatic birth, and as he was working on her, and you know, it's so gentle. And so I thought, wow, how is my little girl, my little crazy, out there, energetic little girl gonna deal with this? But that's part of it. Part of the magic of it, I think, is that it's so calming and so centering. And so she just laid on that table, and he said, wow, she had a really traumatic birth, you know, and I said, yeah.
To perceive what's going on at the deepest level, at a level of cause, through your hands, requires a suspension of a lot of the directive or ego-driven functions of a physician. To us, a great service is when we treat someone and it initiates a process of self-correction and reestablishing of balance that continues to evolve for days, weeks, months after they leave. That, to us, is a great treatment.
The first step is to try to understand why the patient developed the problem they have. And invariably, there's a structural, palpable, what we call somatic aspect to the interference of health. And so what I'm trying to do is find that physical manifestation of the interference of health, which I can feel in terms of what we call tissue texture changes in the body, changes in the freedom of motion of the tissues. And my role is to try to restore those tissues back to normal as best I can.
I went because I had just given birth to my first child. She was a newborn infant, and I had trouble carrying her up the stairs. It was very painful because of my neck. And I had bought, you know, all the baby stuff. I had a baby sling, and it was really painful for me to carry her up the flight of stairs, and she was less than 7 pounds. And so I was depressed about that. I felt really bad. And I thought, what am I going to do? You know, so I had not very many treatments, and I can happily report that I carried my child up the stairs until she was 4 years old, which is quite more pounds than that, purely through the osteopathic treatments that I had. That my neck was a much better neck after that. So then my children go, I go for a lot of things. I'm even thinking, I kind of take them for granted, an osteopathic treatment, because I hurt myself or something happens and I just go get repaired. And I do sometimes stop and think how kind of amazing it is how I've been sustained by these treatments, that I wouldn't really be able to be as comfortable and healthy as I am.
The body is a miraculous machinery that by intent, design, whatever you want to call it, it's amazing to see what the human body can do. And when it comes to osteopathic treatment, the human body will always takes what it needs from the osteopathic treatment, no more, no less. And it will shift, it will change, it will adapt. Oftentimes I feel like I'm kind of in the bleachers watching the process as the body unfolds and releases these dysfunctions and optimizes itself.
I saw things happen that, to my understanding, were impossible for patients. I saw a man come in with 25 years of sciatica, get up on my teacher's table, get a treatment, get off the table and say, "Doc, I feel completely better, thanks, and walk out the door. And, you know, he's this farmer. He wasn't going to get real excited about it, but how can 25 years of sciatica go away? I mean, that's not really supposed to be possible.
Right. I tend to attribute the fact that I'm here, alive, and well, to osteopathic care, because I think it treats all of me.
As the person's receiving osteopathic treatment, you see progress, you see improvement, and in some cases by leaps and bounds. Whereas somebody who's on a steady dose of medication is just that, holding steady.
So I'm very careful about any medication that's given to me. I find out what it's all about, and sometimes I tell them, sorry, don't mess around. Pills are only going to knock it out momentarily. If you want to get it fixed, see a DO.